Historically, Yale New Haven Health had experienced positive margins consistently. So for the last 40 years, we've had margins between 3 and 5%. That flipped on its head during COVID for us. So we initially, when COVID first impacted our environment, we kept everybody employed. So the first priority was to keep our employees whole through this process, and we did so, including we promoted a COVID bonus program during the period to help augment expenses that our employees were feeling. That has only been exacerbated over time. So obviously, with inflation, we're not protected from that. So we've had inflation hit our supply chain, for instance, in a pretty significant way. But labor has been really the primary driver of our increased expenses. We've seen a 17% increase in our nursing costs, for instance, during COVID, mainly because of many nurses leaving the field and the workforce, and our need to fill with either premium labor, overtime, or incentive-based labor, or travelers. Our solutions are going to be very different than they've been historically, and it will include looking at program consolidation, managing what our access to certain programs, how are we going to serve the communities and bring our expenses into line that we can have sustainability. An unhealthy Yale New Haven Health, has ripple effects in our communities because we're such a large part of them. So our ability to do those extra programs, our job training, the support of community groups and activities that absolutely are essential to the geographies we serve, will become more difficult. So I think it's reasonable to expect that we'll have to pull back on some of those investments and donations that we have historically been very committed to. I really think it's important that people understand the sacrifices and incredible commitment that the folks on the front lines and bedside and all who support those bedside activities do on a daily basis. Because to me, that is what needs to drive us. We have the best healthcare system in the world. I think we demonstrated that during the pandemic, and I don't want to lose that pride and commitment and the investments that were made that supported that work. It doesn't go away, and so we have work to do.